So anyway, thank you and welcome. Welcome, Sean. I'm glad to have you and to see you after a while. Um,
Yeah, glad to be here.
we can begin by looking at some of the things that are happening. The subject, of course, is try to understand the safety during this COVID-19. It has been very um, surprising that this wave has done critical in the states as well as in the whole world because it started exploding again in Spain and Italy and some of the countries have been taking precautionary measurements. Ours was probably one of the ones that did not do immediate reaction, but we're working on it and judging for the numbers. I wanted to share this with you guys before we go into it, so we can open the discussion right off the back. This is, of course, the last quarter of 2020, and before we move on understanding the safety of this, we need to look at hard numbers just to understand what's happening in the last few weeks that are left in the year. Everybody knows we have 52 weeks, and we are just passing 46. So with that, let me just go back and say that it has been reported just in the United States of 147,000 more cases since the January 21st. We've been logging about 52 cases in the last few days per 100,000, and of course, added to the 255,000 deaths, we had about 882 more deaths in addition to it in this particular wave. Apparently, we have a good hanging, but it is important for us to notice that also there's people that are more conscientious about this and being tested most of the time. In the United States, we are really doing a lot more testing, and of course, as expected, there was a jump of about 7.5 or a little bit over 7.5% or more people being positive. Okay, all this information that the CDC is showing us did not correspond to the actuality that we were having. But now it's a lot more visual, and we can see that. I think that we're in the process of ramping a new type of prevention, and I'm hoping that that worked for us. Many countries in Europe already started their seclusion, and we're talking about prevention measurements for the most part. Just follow the rules that would allow us to be having less amount of fatalities, and that's about outside it. This is the way it looks right now. If you look at that curve, nationally, the surveillance indicators are tackling levels of SARS and COVID-2 virus circulation and illness that have increased since September. So the percentage of death due to pneumonia, influenza, or COVID-19 increased throughout the month of October. So if you look at this drawing, you can see the red color or the blue color is the amount, is the curve that shows that we are increasing a more percentage of positive cases. Okay, and then if you look also at the gray color one, the gray color one is also showing that in week 44, we start increasing the amount of people hospitalized. And of course, the people that got hospitalized, many hospitals collapsed, and many of them really worked very fast. But in week 46, we're beginning to see that the amount of deaths start decreasing considerably, and also the amount of hospitalized people start. So we still have positive cases, but this is showing me that we in the week 46 we get a pretty good handling already. So you see that, okay? a very brief summary of data of hospitalized. As you can see, uh, in this case, they are testing for colds and that type of anomaly. And right now, we are at the minimum and very low, with the exception of Indiana and New Mexico, which is beginning to go up out of the low mode, and going into the moderate mode. But there's are probably the influenza illness like activity indicator that responds to the people going to the hospitals because of it. Okay. So with that, there's quite a few things. What now? What do we do from now? So this will basically open our discussion of this particular webinar, So with that in mind, on the right side, I have some questions in there that I want you to keep in mind. And if you would like to share with us those questions, it would be very grateful. We will be very grateful, and if we can expand on them. I really would like to know how this COVID-19 has impacted you professionally, or impacted you in your families and your neighborhoods, and what are you doing as a leader to try to overcome this? Are you doing anything? What are your routines have changed? And pick one of those questions and just keep it in mind as we move on and begin our discussion. Okay, so with that in mind, I just would like to know, Sean, how would you say this thing happened to affecting you? I went through, like I said, I was in California last week, and I see a lot of people without jobs. I see a lot of people that are concerned. The amount of unemployment is very high, and is something to be concerned about. What do you see from your angle?
As you know, being in consultative sales, it requires me to, go and meet with people and find out what their needs are and all of that. It's been very difficult to get into plants because of the COVID, because of their procedures. Mm-hmm. So that's been the huge challenge for me.
Very interesting on trying to see if how is it that we are able to manage and continue operating in the plant. Everything has changed. The operators that are hand packing, wherever we don't have animation, they're separated by clusters of walls, plastic walls, that they cannot talk, and everybody has the mask. Definitely their procedures have changed. Every time I walk into corporate offices, they measure my temperature. Every time I walk in corporate offices, they do the test and all that stuff. Other than that, I'll tell you, I can see the behavior of people in places like the airport. And because of the weather that is changing, you hear a lot of people coughing, sneezing, and that doesn't help anything, because if this thing is airborne, it will do a number on us. That's what I observe. Hello, Gary. We just went through a presentation, a very short presentation, in where we showed the latest numbers of fatalities, and we see right now an improvement on the amount of deaths and the amount of hospitalized people, but we continue to climb up on the positive cases. Okay, so this that you see right here right now is the last slide, in where basically I left it open for you guys to make comments, and we were going through telling us what your experience has been with the COVID-19. And I was explaining to all of you that my basic perception that I had, as I was in both countries. I was in South America, and they handle it a little bit different. and then I came here, and we handle it a little bit different. So to be honest with you, there was two different styles of handling this thing, and I think it's because of the foundation. Our American society values their freedom, and American society don't participate of enforcing anything. But unfortunately, in South America, they tell you one thing and you must live by that. That's what it is. So for these questions, how you plan to celebrate Thanksgiving, Gary?
At home with the immediate family.
Okay.
And maybe call extended family, like wish them a happy Thanksgiving. Yeah.
Absolutely. Is that your baby?
Yeah, that's let's see, there they both
are. Hello. To be honest,
this is
hello, wife, how are you? Well, welcome all of you. I'm glad to see the family together. That's
You've got a beautiful family.
Oh my Lord. Yes. Gary, you're a very fortunate man.
Frank at the moment.
What's that?
They're waiting for Chick-fil-A nuggets.
All right.
Yeah, man. Those things are great.
Guys, I didn't say this, but the webinar include chief filet nuggets. So thank you, Gary.
Courtesy of Gary, right?
Courtesy of Gary, So let me just ask this: Are your children being affected in their jobs, or their kids going to school? How, now that I know that I met your children, how is that affecting you and with your children, Gary?
Well, it's not affecting these too much, but I got 2 adult children that are in college, and
that's affecting.
Yeah, they're doing online school.
All of them will definitely go the online route.
Whereas the younger one, he hasn't had that experience.
Yeah.
And his grandparents came to visit him over at our house, and he wasn't used to that contact. So he had through that. And we didn't really, notice until that occurred. But yeah, it's having an effect on the babies.
So it is affecting a lot of people.
Because and it's real critical for them, I think, because they're not getting that they're not getting that, hey, let me hold the baby for 5 minutes.
Right. that doesn't work.
Yeah, so yeah, he's definitely been affected by the lack of interaction.
Wow. Yeah, so it's definitely changing the life of many of us as we know it today. Same with you, I suppose, Sean. How your routines probably change. You were telling me about that. I definitely tell you that I've been in 2 states since I came back to the States. That rhymes. I was in California all week. I saw the behavior of a plant, how people are egressing and egressing of the plant. I saw the behavior of the operators working the products. I tell you what, if they used to follow the GMPs before the pandemic time, now they are really enforcing this very, very every hour on the hour, because we have people working next to ovens and people walking into ammonia compressor rooms that there's a lot of noise. They'll come back and measure your temperature. Their behavior has changed a lot.
Let me ask you this. This kind of goes back to that chart you showed a little while ago about the influenza rates, that those are just like so low. Every state looked green except for Indiana, I think. And I think maybe it's because everybody's developing healthier habits. They're wearing face masks. They're washing their hands obsessively. And I mean, I went and got a flu shot Monday.
Oh, you did?
Yeah, I did, because I have no spleen. I had a motorcycle wreck many years ago, and I lost my spleen. And the first time that I ever got the flu with no spleen, I said, never again. I'm always going to get a flu shot every year. That's the one right there.
This is the one, right? I can see here that Indiana and New Mexico began getting more flu cases than everybody else, and we continue to be here. But the more we walk into this winter and knowing how cold it's going to get, I will say that when we get to this area of the moderated and low highs, then is anybody's, it's anybody's guess, because as you know, this virus is similar to the influenza, so you will don't know what is it. Did I catch a cold, or do I have this virus already on me trying to grab my lungs? You know what I mean? So yeah, so the more you test it, the more you will do this. Let me ask you this. We already talked about the routines, Sean and Gary, and we talk about how are you going to celebrate your Thanksgiving, Sean?
Well, as you know, I live on a 22-acre blueberry farm way out here in the middle of nowhere. So, I mean, I don't feel like I could be any safer than where I am.
Oh, you are.
We're going to have one visitor, and that is my wife's father, who is recently widowed. He lost his wife last month. Dawn lost her mother.
Sorry to hear about your loss.
Yeah, well, thank you. That means a lot. But yeah, he's
my
80,
condolences.
Mm-hmm.
And he's coming to Thanksgiving. That's the only guests that we're going to have here, because this is a good, safe place for him to celebrate. And
yes.
I haven't been exposed to anything because I just don't travel that much these days, much to Gary's chagrin.
Yes.
I'm supposed to be out there rounding up some work for everybody, and we've had some successes here lately. But that's just pretty much where we are. Now, one thing I was wanting to bring up to you, though, is that there is a vaccine. There's actually 2 vaccines that are coming out. And I don't know if you are aware of this, but these vaccines, they have to be taken in series, 2 shots a week apart. All right?
Yeah.
And when you get that first shot, you're going to get sick. You're going to get really sick. And I hear that the second shot is even worse. That when you go to get that second shot, you're going to want to take the day off from work the next day, because you're just not going to feel it.
So let me ask you. Yeah, that's what I would ask you.
Yeah, the danger is that people go in and they get that first shot, they get sick from it, and they don't come back for the second shot. That's the danger.
Okay, so are you saying that is shocking people, or I understand that I received an email this morning recommended for me to be very careful about taking those shots because they let's see. Okay, let me see. What I have in here is COVID-19 vaccination. It says in here that we got to be careful of this because the vaccination is made out of a fetus that is 14 months aborting, and it's coming from the lungs of one of those fetus, one of this baby. It is very interesting, and they tell me we be very careful. Don't try it out. I haven't tried it out, but I also wanted to make sure that we're talking about the same thing. So there's a vaccination out in the market.
How confident are you in the quality of that information?
This comes from, let's see,
Rick?
it says COVID-19 AstraZeneca. It's a vaccine.
Yeah,
that is there.
AstraZeneca.
Yeah, it says this is, and I have it right here. They're basically showing you that you need to be very careful on this thing because where is it coming from? The vaccine and everything else. And basically it's telling you.
That information, is that coming directly from AstraZeneca? Because that doesn't sound like something else.
It's coming directly from a study that is being done in the university in Johns Hopkins right now. And
Okay.
they're showing you the abstracts. They're telling you to be very careful, because if you're getting people sick with the first shot and they're not coming back for the second shot, that's telling you something, that's telling you maybe we need to wait a little bit. I don't know. I was not aware.
We have to be very careful with this kind of information also. We have to confirm the source of them. There are a lot of disinformation right now.
And it's going on all the way, What I recommend, because we are coming basically to the end of our hour, but what I truly recommend is let's wait for the vaccination that will be here next month, and let's see what happens when they give it to the first responders and to the health, to me, my heroes, the health heroes, and see what happened and look at the reaction. It seemed like this, after 95% satisfaction and approval of efficiency, it tells you something in there. You and I and everybody in this forum are technical enough to understand data, and we are data-driven people. If you don't see a trend and the trend is telling you that NH3 is going up and then there's a leak somewhere, Gary, you understand that very well, what's going on. You'll probably run immediately and try to find out where. And what is your first tool? Your nose. Where is it coming? So we understand that portion of it. But I tell you what, I'm glad that you mentioned that, Sean, because I wanted to know some validation about it, and it appears to be already in the market, isn't it?
I mean, you probably got access to the same reports that I do. I would caution you, though, to look at whatever information that you're getting with a jaundiced eye, because there's that section of society out there that is highly suspicious of vaccines in general. Not just this, but and they put out a lot of misinformation, and you just got to be careful that the information that you're getting is actually reputable.
Yeah, you got to be very careful. You got to.
Ricardo, Richard.
Yeah.
Oh, sorry, it went out. Do you hear me?
Yeah.
Okay. You know that my daughter is in charge of some teams here regarding this COVID-19 thing, no?
Yes.
And my son-in-law, he's going to be in charge of on the national team for the vaccination here.
Yeah.
And you also know that here in Peru, we are doing the trial for the Sinopharm vaccine, the Chinese vaccine, one of the Chinese vaccines.
Okay.
I wanted to be part of that trial as a volunteer, and I asked that to my daughter, and she told me, let's see first what happens with others. That's what you said now, so that's clear for me.
Yes.
Let's see what happens.
Yeah. Yes. I'll tell you what, when they keep or when they captured the devil, they didn't catch it because he was the devil, but they catch it because he was old enough to realize
Yeah.
to realize these things, you know. So and this, Gary, I put this in purpose because I want you to see that on the right here on the last week, this is week 46. Okay, that's 2 weeks ago, or I think is we got 52 weeks a year, so this is week 46. We see a decrease in people hospitalized and a decrease in people dying. This curve in here, dying. We continue to see this curve, the blue one. We see that the infection continues to happen, and that's what we want to see. What we want to stop is the death, and we want to stop less people in the hospital. It looks like it's going in the right direction. You agree with that, Sean? You agree with this?
Absolutely. I'm sorry, it took me a little while to get my mouse cursor
Yeah.
back. I got
No.
two monitors there.
Yeah, this one is the amount of hospitalized, and in that week is beginning to go down, and the amount of death, which is this curve, is beginning to go down, and the amount of positives continue to climb up parallel. So it is what it is. It is happening now that way, and this is what we want to see. The less amount dead, the better we are. All are.
Yes, that's right.
Yeah. It appears that it is coming to an end. I want to ask you all your last word, please. So, Gary, you want to start? I want to start with you. Do you want to leave a thought about it so our audience understand where we are today? Well, that was quick. Apparently, somebody pressed the button.
I think you're trying to unmute his microphone. He's mashed.
There he is.
Oh,
We hear you.
There we go.
No? Yeah, right now. Yeah.
Okay. Yeah. It looks like to me, that we're probably getting more cases, but the seriousness is going down. But we have a lot of areas that don't do the masking or the other things, and looks like my battery's going dead. So.
No, but Gary, we got your thought, and it really is. The masking is probably one of the most difficult things to do because it's so dynamic and it's happening every hour on the hour, every minute of the hour, that it's hard to monitor, and we have to depend on hard numbers the following day. But as I can see it, we're going in the right direction, and we'll just need to be a little bit more patient, and we will achieve that. How about you, Mr. Crown? We're getting to this also, to the end of this hour.
Yeah, I guess the thing that strikes me is that there are actually opportunities. I see opportunities coming along. I actually see some good things happening from this pandemic, and I know everybody's really focused on all the bad aspects, all the death and destruction and economic hardship and everything. But there have really been some opportunities here that I think people should focus on. People are spending more time with their families now.
That's a positive. That's a positive.
Absolutely, it is. They're people are working at home.
Mm-hmm.
And I think this is going to be a defining moment in our culture, when industries, when businesses, the companies that we work for, figure out that people actually can work from home, be productive, don't have to do that dangerous and environmentally destructive commute to a brick and mortar building every day.
Correct.
I see good things coming from this. I see good environmental impacts. I see more time with family. I see a general improvement in the quality of everybody's lives.
Yeah, I have to agree, Sean. You're right on the money, because if anything that we have to rescue out of this is that has brought our families closer, and that perhaps is the entire message that comes from way up there, up above. Maybe we were too far out, and this is what's happening to all of us. That is absolutely true, and I thank you for that advice. Carlos, your advice for all of us?
Okay, I agree. I agree 100% with Sean. This virus has made us understand many things that we have been having that for just done, and now we have value more family time, friends time, environmental care, many things. I think that's the positive of this issue. But I also think it is too soon to think and to behave like we are already winning this battle, because this is a battle we have to pursue, and we still have to be very cautious, careful. Yes, there's a light at the end of the tunnel, but the tunnel we are inside the tunnel yet. Correct. And we have to be very careful and and keep distancing, social distancing, wear masks, and also take care of what we are touching, no?
Absolutely. We're still too early. Until we get that vaccination going and feel much more secure, that would be good. But the positives coming out of this, I think, is all positive in many ways. Yes, remember, we were focused and centered only on our jobs. And sometimes our jobs, although they're necessary evils, we forget that our fundamental belief is our family, is our people, and I think this has been a knock in the door to remind us what our priorities should be. And with that, I want to thank you, all of you, for coming today. And listen, let's do this again. This is beautiful. I'll make copies, and I will definitely get back to you. Okay, Gary, thank you.
Nice to meet you.
Yes, Sean.
As well, Carlos.
Yeah, y'all have good.
Yeah. Thank you so much.
Bye bye. See you later.
Thank you. Bye bye.